Texas rural health care in crisis. Two different approaches to two slightly different problems.
Take a good look around you, especially if you live outside one of the major or mid-level cities in Texas. Your health care has changed. In some cases, it's just vanished.
Our Dennis Turner took a look at two communities with slightly different hands in the game and their different approaches to the life-threatening problems their vanishing health care created.
We've asked to raise the tax base to
A few years ago, you might have called this public hearing unthinkable. The Fairfield Hospital District Board explains its plans to almost double its tax rate from 12 to 21 cents just to keep the hospital afloat.
I see so many small hospitals that are closing and going by the wayside where people are having to be transported great distances for their health care.
George Robinson doesn't want to see that happen in Freestone County, and he's ready to open his wallet to prevent it.
And what you're going to find is we're going to lose a lot of citizens. And I don't want that for our people here in this county.
What does he mean by that? Travel down the road to Rockdale, where the company that ran both of Milam County's hospitals closed them down, leaving volunteer fire departments as the only emergency medical care aside from an ambulance, and we're talking basic as it gets.
Our volunteers are basic first aid trained, CPR trained, and AED trained.
Ambulance wait times increase while the departments take more calls. Without a currently operating hospital, Milam leaders have their own plan for a safety net.
Our hospital board is discussing opening an additional clinic here, if I understand that correctly. But again, that's going to be at a burden to the taxpayers. They're talking about a 16.8% tax increase.
Would it just be an urgent care kind of place?
It would be a clinic. It wouldn't be a hospital.
Doctor's
Wouldn't be an
offices.
emergency room. So yes, that would be great to have.
Right.
No, it's not good to put an additional tax burden on our citizens.
And no, it's not enough, right?
Unfortunately, it's not.
Either way, the folks in both these two counties will pay more for vastly different levels of care, using the same basic argument.
We need this facility here to protect the citizens of this county and to protect our people who are traveling up and down the interstate.
In Fairfield, Dennis Turner, Central Texas News Now.